Hi, my name is Lauren, and I'm with Susan G. Komen of Orange County. I'm going to talk to you a little bit today about breast cancer and our breast self-awareness messaging. So, a couple things. The most significant risk factors for developing breast cancer are being a woman and getting older. But men can get breast cancer too. It is rare. For every 100 diagnosed cases of breast cancer in women, there will be one diagnosed in a man. Overall, in a woman's lifetime, she has a 1 in 8 chance of being diagnosed with breast cancer. And unfortunately, every 12 minutes in the United States, one woman will lose her battle with breast cancer. That's over 42,000 women this year. Age, family history, ethnicity, lifestyle, and more can contribute to your risk factors. But with advances in research, clinical trials, treatments, and access to timely healthcare and screenings, we now have over 3.8 million breast cancer survivors here in the United States alive today. So I'm going to go over what Komen says is our breast self-awareness messaging. There are 4 parts to this. The first part is know your risk, and that means talking to both sides of your family about your health history. Any previous cancers in your family or other things that you want to bring to your doctor's attention to help assess your individual personalized risk for breast cancer. So again, bring those things to your doctor when you talk to the doctor, and talk to the doctor about number 2, getting screened. So if you are at average risk for breast cancer, Komen recommends starting clinical breast exams at age 20 every 3 years. And then when you hit age 40, you'll have a breast exam, clinical breast exam every year after that. As far as mammography, again, for average risk women, you would start mammograms at age 40 and continue that annually. But if you are at higher risk, your doctor may have you start screening at an earlier age or with a different screening modality, maybe a diagnostic mammogram, an ultrasound, or an MRI. You can sign up for a screening reminder at komen.org/reminder to get your annual checkup. The third thing is what we call know what is normal for you. So what's interesting, breast cancer, we normally think of it as one disease, but it's not. There are different cells, types of cancer. In breast cancer, different markers on the cells, and sometimes that means that the cancer itself shows in different ways in people's bodies. So not all signs and symptoms are the same for each individual. We want you to know what is normal for your breasts and what is abnormal. And the biggest takeaway is if you're experiencing something abnormal for you, please talk to your doctor about it. So Komen has developed our breast self-awareness messaging cards, and it goes over pictorials as well as explanations of different signs and symptoms. So I'm just going to run through those quickly, and at the end there'll be a QR code for you to access this, this 2-sided document. So the first is a lump or a hard knot, any thickening of your breast tissue and as far out as your underarm. Next would be swelling, warmth or redness, or even darkening of the breast tissue, a change in size, especially between one breast and the other, dimpling or puckering of the skin, experiencing itchiness, a rash or scaling on nipple, pulling in of your nipple or any other parts of your breast tissue, nipple discharge that starts suddenly, or just sustained pain that will not go away. Again, some women are saying, I can't sleep on a particular side, or it's uncomfortable when my arm touches an area because, again, you're experiencing some pain. These are all things you should take to your medical provider. And finally, number 4, make healthy lifestyle choices. So this includes maintaining a healthy weight, making sure that you add exercise to your daily routine, limiting alcohol intake, limiting menopausal hormone usage, and breastfeeding if you can. If you have any other questions or you want to learn more about breast cancer, you can visit komen.org. You can also call the Susan G. Komen Breast Care Helpline at 1-877-GO-KOMEN. You can email them. They're available to speak to you in English and Spanish Monday through Friday. And like I said, we also have the digital version of the BSA card you can download. And BSA cards are available on Komen's website in over 40 languages. So thank you for your time today. Hope you learned a bit more about breast cancer. And please check out komen.org if you need more information. Take care.